it costs a lot of money for folks to be admitted into the hospital and to be treated with these health concerns that are in large part driven by diet and lifestyle choices that are in large part affected by access to things, whether that's food or green space, so parks, things for people to be mobile outside, education, etc., housing, all of that stuff. So it costs, I don't have a hard number that I could give you, but if you think about what it would cost to buy healthy food in comparison to what a visit to the ER would be, it's like a night and day difference. It's so much more expensive to be treated in the ER for these issues, than to get the resources in the community. So my thing is, I think it would be way more economically savvy and financially savvy for all of us if we were to tackle this issue in the community directly, even though it would require money to be poured into the community. The long-term benefit of seeing those healthcare costs go down would be something worth thinking about.
Just throw a number out there. I'm curious. Just throw a number out there. How much healthcare costs associated with food security it is? Do you think?
All right, you're gonna make me Google it because I don't want to throw a number out there.
No. You're like 16 gazillion.
No. I checked the link out in the message. Let me tell you, I already have that figured by state, by the way.
Oh, you do?
You look this up, and then you're trying to get her to like.
I know. I'm like, I don't.
They're trying to push her into a corner.
So check this out into CDC website. They have it broken down by state. If you scroll down the chart, and you can show that.
Oh, I see. I like that.
Oh wow, crazy.
Look at Florida and
look at Florida in general.
The South has a big food insecurity issue.
It's in billions. People, healthcare associated costs with food insecurity is in billions.
So look by county though too. Orange County is right in greater than 20 million.
That's so crazy. Like and look at the per capita too.
Yep. So 1 in 6 adults in Central Florida is food insecure.
Why is it that like, what is this, like Colorado, Montana, not North Dakota, South Dakota?
Why they're light? It's
why are they so light?
I mean, it's also probably a little bit less dense population though. Also, as well, keep that in mind.
They might have more farming as well.
That's true too. Yeah.
I think those Midwestern states do a little bit more agriculture, and so maybe they have more programs set up, but I don't know specifically. That's just a guesstimate.
Yeah, but anyway, this whole if you could dissect down more into the county level too as well. But yeah, this is a good like I guess source of studies that they gathered together. They gathered, I think 2016, I believe, or I think they just recently published this.
I guess when you look at it like per capita by county, it's mostly in like Texas, Louisiana, Alabama.
What's in the Southeast? Like you mentioned.
Oh yeah, this came out in 2019, so this was pretty recent.
Yeah, it's actually, I mean, it's probably gotten worse since then, to be honest.
This chart is from 2012, 2013.
Yeah, I think that, in a couple of years when they're looking at what's been happening during COVID, we're going to see those numbers completely change. And you might see it look a lot different in those Midwestern states than it does right now. Yeah,
look at Florida alone. That's the percentage of adults is like 12%, over 2 million. And of kids is about 20%.
Where are you?
I'm in the table 2 on the bottom.
There's a table?
Yeah.
Oh, tables. I see.
Yeah.
There's even more tables. I only went to like the visual and then I stopped looking.
You like the visuals only?
Yeah, visuals were nice.
To be honest with you, I did not expect this kind of number though. But when I saw this, it's like, holy moly! I was like,
it's a huge problem.
And that's because we're not being proactive at it. Imagine the fact if we can even change this by like 1%. You know, like the impact of being proactive.
Yeah. I think being proactive is a huge thing. I think having conversations like this is another really important thing to do because it's education number 1, but then it helps break down the stigma of food insecurity as well, because it makes it more relatable of, wow, this is happening to a lot of people. This isn't just a specific group of people that are at risk for this. And with COVID and people losing their jobs more and more, it's impacting a lot more people that weren't food insecure before, but now are.
But this is also including, like, this food insecurity is also including people who just live a bad lifestyle, right? And just only go to like these fast food places, and they have food, but they don't really eat
Well,
as well as
I
they
mean,
can.
but that's because
no, it wouldn't include those people unless they couldn't afford their food, right?
so it's
that's the choice. Like, so if you have access to foods that can help provide a healthy and sustainable lifestyle, but you're choosing not to,
that's a different story, though.
Yeah, you're still putting your money towards something.
Yeah.
You're making that choice. Whereas, you know, if you might be relying on that fast food
So
because you don't have any other
all of these
choice.
numbers are based on like people taking that survey and saying that, oh, they are food insecure, and this is the result of it.
So we would have to look and see where they got it from, but I think it's from a survey, or it might be from a national.
If you scroll down, it's appendix. There's appendix there that tells you this.
Yeah, National Health Interview Survey, Medical Expenditure Panel survey data.